Welcome, and thank you for joining the Fielding School of Public Health's Continuing the Conversation webinar. Over 250 communities in the U.S. have passed resolutions to stop hydraulic fracturing, concerned that it introduces industrial activity without critical information about environmental public health impacts. Dr. Richard Jackson, Professor and Chair of Environmental Health Sciences, is one of 3 individuals appointed to review New York State's environmental report on shale gas development. He will discuss what hydraulic fracturing means to the environment and suggest approaches to better protect human health. We want this to be a dialogue, so we will allow plenty of time for questions. If you do have a question, simply type it in the field at the bottom of the chat window in the bottom left-hand corner of your screen. Let's get started. Dr. Jackson.
Good afternoon and Happy New Year. I'm Dick Jackson, and I'm going to be talking about why energy is a public health issue, why public health has not been adequately at the table for a lot of the energy issues, and that hydraulic fracturing is an example of one where public health must be at the table much more than we are. This rather elaborate diagram, it's pretty in its set of colors, is remarkable because it summarizes estimated U.S. energy use, about 100 million quads per year in 2011. Pretty striking how small solar is, how big natural gas, coal, and petroleum are as you go down the left side of the diagram. And as you go over to the right side of the diagram, it's also striking how much energy is quote-unquote rejected energy. It ends up not providing us the services that we need. And I'll come back to that as I go forward. As I said, we use, in this slide, this is from the Energy Information Agency of the United States government, per month, and this is not per year, per month, about 70 quadrillion BTUs. Fascinating, it's about the same amount we were using in 1973, and we've added 100 million population. So a lot has happened in terms of efficiency going forward, but a lot more could happen. I will going to come back to this slide because health researchers always are arguing for more health research, but one of the things I'm going to be arguing for is more energy research. And you can see the green stripe there and how it went up during the 1970s and then diminished during the 80s and was really negligible for about the last 10 years. And I think this is a health hazard, a health threat. Every use of energy has its own set of hidden costs. This report from the Academy of Science is very helpful, and I drew upon it as I prepared my report here. And every single one of these energy sources, biomass, coal, tar sands, nuclear, natural gas, has some kind of impacts. Many of them are health impacts, and I will touch on them before I get to hydraulic fracturing overall. Probably one of the biggest threats to human health worldwide, particularly for poor people, in developing countries, has been the enormous numbers of deaths. 500,000 deaths for children from lower respiratory illnesses in India alone in the year 2000 from unventilated cooking areas in homes. And think about how much work had to be done just for that woman to be gathering that much wood to then cook a small fire to prepare her chai. As this has direct impacts, people that are breathing it overall, but in the process, large amounts of black carbon are put into the atmosphere. We've all seen tar burn or tires burn, and we know how much carbon it puts into the air. And carbon is, and most people are aware that carbon dioxide is a greenhouse gas, causes global warming. Methane is a greenhouse gas, aggravates global warming about 15 times more effectively than carbon dioxide. But black carbon in the atmosphere absorbs heat when it's floating around in microparticles and makes things hotter, but it also, when it lands on Greenland and on the Arctic ice, it causes much more absorption of heat into the, and aggravating the melting on these areas. Global melting will be and is a human health issue. Anyone that's driven through West Virginia is astounded at the scope of coal mining in the United States, and as you go around the world, it's even more striking. Of course, there are health issues related to this. In West Virginia, we've seen mountaintop removal, where overburden, as they call it, is removed from the valuable land there. It is then put into gullies and stream beds and hollows with damage to the environment. And for a long time people argued, well, we need this because it creates jobs. Well, a site like this can be operated with not very many people. It generates wealth, but it doesn't necessarily generate that many jobs. We still produce a lot of energy in the United States from burning coal. Californians are pretty proud of the fact that we don't have a coal-burning power plant in California. We have nuclear and hydro and natural gas and petroleum. But the truth is we have two huge power plants that we draw on that are outside the state. 6% of all the CO2 production by the human species is related to cement manufacture. Think about when you start baking limestone, the CO2 that's produced both by the baking process and also by the driving off of the CO2 when you do it. Lots of coal is being burned for other kinds of manufacturing and still being used for building and heating. Fish in many parts of the country are told, women are told not to consume it, particularly if they're pregnant. Young children should not be consuming fish, in large part because of mercury that falls from the atmosphere, in large part again from coal burning. A coal burning power plant, when the worst top 20% of them produce far more damage than the rest. But look at this number. It's about $800 million a year from the top one. These are hidden costs of coal burning, and I'm going to come back to that number as we go forward. Somewhere less dense than coal but more dense than petroleum is tar sands, and perhaps many people have not seen the scope of the tar sands. For example, in Alberta, it takes about $30 to make a barrel of oil, $30 worth of energy to then generate an equivalent barrel of oil from these tar sands. So the economics are important to it, but the scope and the volume of the materials that are produced and the quantities of water that are required for the production of these tar sands. Dan Kamen gave me this picture, and you can see the sulfur mountains, if you will, in the distance from the extraction of sulfur from the oil that's being produced from these sites. And there are these huge blocks of it, one after another, in the production. This ultimately has health effects as well. 125 years ago in Titusville, Pennsylvania, 4 guys with basically a water well drinking apparatus were able to strike oil at about 75 feet. Nowadays it takes $1 billion platform going down about a mile, and then these platforms that drill down a mile or two then go off to the side. And you don't need to tell anyone who lives along the Gulf Coast that petroleum production, oil production has health impacts. There's a health impact just by the loss of the seafood production that is in an area, and most of us are told we ought to be eating more seafood and less red meat. And I'll come back to this as well. But there's CO2 production, there's SOx, there's nitrous oxide, sulfur dioxide production. Most people, everyone knows that gasoline runs about $4.5 in California per gallon, but there are serious scientists that would argue that really the environmental cost, if it were properly incorporated, would be closer to $8 a gallon. And Lester Brown, World Watch Institute, argues that it's really closer to $15 because much of our military structure is put in place to protect supply lines of oil, petroleum from the Middle East. And there are lots of reasons why we don't want to be dependent upon regimes that are fairly either hostile or unstable. You can tell I like these graphs, but you can see that renewable energy is pretty flatlined, although it started going up around 2005 or so. Nuclear power has a significant portion of energy production in the United States. But look at natural gas. Around 2005, it begins to tip up, and now it's higher than coal. And you see this thing called crude oil and NGPL. Well, when these hydraulic fracturing wells are drilled, a distillate is extracted as well as the natural gas, as well as the methane, and that production has increased as well. It's one of the reasons these wells, by generating both methane and distillate that can be used for gasoline and other things, is important. I don't need to tell really anyone that nuclear has its own set of issues. I think one of the biggest problems with nuclear is we're still using what I would assert to be 1950s, 1960s technology, maybe even more primitive than that, and siting it in places that don't make sense in terms of tsunamis, earthquakes, etc., is its own set of challenges. I really was quite interested in how much the United States Department of Energy worries about energy efficiency and renewables, and so I looked at their budget. And possibly many of the people on the line don't know that only 8% of the Department of Energy's budget goes to energy efficiency and renewables, and a third, more than a third, of the overall budget goes to nuclear security. And the United States spent close to $10 billion to secure a safe repository in Yucca Mountain in Nevada. That appears not to be going forward, and we still don't have ways that satisfactorily deal with nuclear or radioactive wastes in this country. So it's a negative, a drag on the desire to have nuclear energy and to utilize this. Now, hopefully this slide will come up in a second, but it is corn ethanol, and something like 98% of the state of Iowa now is under production for corn and other commodity crops. And there are actually incentives in the federal legislation to have this happen. Why is that a health issue? Well, one is it's shockingly inefficient to be using just the cornstarch and the corn kernels to make ethanol. It makes sense to have ethanol. It's an oxygenate. To put it in the gasoline, it reduces carbon monoxide and other pollutants coming out of the tailpipe. And oxygenates are a reasonable thing, but it also means that enormous amounts of land in corn-producing parts of the United States have been turned over to glyphosate-resistant crops. That means that really nothing can be grown on that land besides glyphosate-resistant plants, such as these special corn. But it also means that virtually every child in the Midwest is consuming nitrates that are running off the cornfields and atrazine, some of the other corn herbicides that are being used as well. It also is a big contributor to the fact that something like 6,000 to 7,000 square miles of the Gulf of Mexico dies every year because of runoff down the Mississippi River. Hydro, does it have health effects? Well, there was a time that salmon was cheap and abundant, and as everyone knows, it's very expensive, and non-farm raised salmon is pretty difficult to get, partly because of overfishing, but partly because of the damming of the rivers of many of the areas where they produced. Again, a technology that needs to be developed much further into the 21st century are wind turbines. There are reasonable people that are concerned about noise, bird losses, and the rest. This can be fixed, and it's clearly a reasonable and good source of energy and an increasing source of energy. But as you go down the Altamont Pass, there's an awful lot of turbines that are small, move too fast, and probably need to be changed out for much smarter kinds of turbine production. So again, if we had been doing the research back during the 1980s to develop batteries that could hold energy from whether it's solar or wind turbines or the rest over much longer periods of time, much more efficiency and gearing of these turbines and other kinds of research, we wouldn't be in the situation we're in. This is from President Obama's report back in 2012 talking about renewable electricity generation. We've made real progress since 2008, over a doubling of renewable energy production. And I don't know what slide just would not appear, so we can just skip that for now. But you can see that CO2, the important part of this slide is it's not energy production, it's CO2 emissions, it's greenhouse gas emissions. And you can see natural gas is considerably lower than coal or petroleum in how much CO2 it produces. But look how much more energy now is coming out of natural gas versus coal, crude oil, nuclear, etc. So there are a fair number of reasons environmentally why natural gas would be preferable. And if you look at the aggregate damages Remember the other slide I showed where it was 800 million in aggregate other costs from the production? For methane or natural gas, it's about $8 to $10 million. So there are benefits, and many of the old coal-fired power plants are moving to natural gas, partly because they can be turned on and off, and they're less expensive to build than a coal-fired power plant. So I'm going to try and not to use the word fracking, high-volume hydraulic fracturing, and I'll talk a little bit about the methodology. And again, this slide is not showing up. I don't remember what slide this is, but it's a map of the U.S. showing major sources of underground methane production. Up in the top left corner, you can see just how much methane is in the shale of the northern Rockies. Texas and Louisiana have produced large amounts of methane, although in many ways the distillate that they pull out is often preferable, and I've seen videos of the methane being just released into the atmosphere. So it is extraordinarily important to be capturing everything that's coming out of these wells. By the way, when it comes out of the wells, the gas is often mixed with water. It has to be separated from water. It has to be then odorized, and there are problems at each one of these steps. If the odorant, for example, the butyl-mercaptan, goes out through the neighborhood, it will make people feel absolutely miserable. The water has to be removed. The distillates have to be recovered as well. But the prior slide was showing worldwide shale gas reserves, and when you look at it, you're struck by just how immense this enterprise is. Shale gas production, 14-fold increase over the last decade, and so-called reserves, at least identified reserves, have tripled over the last few years. And you can see Texas is the big producer from this slide. Marcellus Shale, which is New York, Pennsylvania, Ohio, West Virginia, is still just coming online in this slide. A very important law change occurred back in 2005, and it was when the U.S. Clean Water Act, in fact, has in place very stiff penalties for those who contaminate the water resources of the United States, whether it's freshwater, saltwater, rivers, etc. And back in 2005, there was an exemption put in the Clean Water Act that said water, gas, or other material which is injected into a well to facilitate production of oil or gas is not a pollutant. So well, that's good. It was a relief to know that the federal government no longer considers that a pollutant. And this is called, I'll tell you the name of it in 1 second, because the same thing happened under the Energy Policy Act of 2005 to the Safe Drinking Water Act, that fracking fluids, the propping agents, and other than diesel fuels that are put in these operations are not considered pollutants under the Safe Drinking Water Act. And this is broadly called the Halliburton Exemption. And as I look at the rapid increase in hydraulic fracturing since 2005, I wonder about how much this exemption from these laws has really had an effect. Well, what's the other reason? Here's a good source of energy. It isn't quite as polluting as other sources. Why else has it taken off? Excellent report from Penn State. And here, as they looked at Pennsylvania and the Marcellus Shale, which is, again, the area near Pennsylvania and Pennsylvania itself, look at the millions of dollars that would be added to the economy in 2011, $10 billion in a states that really are struggling, and many of the rural areas in these states have had a hard time. $1 billion in state and local taxes. You can imagine any elected official that's looking at this is going, oh yeah, I want to have fracking in my backyard. I remember getting off a plane in Washington, D.C. about 2-3 years ago, and it seemed like every other huge advertising sign at Washington National Airport was telling us about how many jobs and how much energy and energy security we would get by having broad-scale energy extraction, particularly gas extraction in the United States. Oh my goodness, I don't know what that last slide is, but I'm going to skip it. A lot of what I've been talking about I've extracted from a wonderful session that was held by the Institute of Medicine, National Academy of Sciences, in Washington, D.C., April of 2012, and any of you that are online can go and hear and see at least the PowerPoint for each of the presentations at that meeting. Just search on Health Impact Assessment, New Energy Sources, Institute of Medicine in 2012. It will come right up, and you can find the references that you want to see that I will be using. One of the presentations was from Shell Chemical, and you can imagine in this setting it was a very well-honed presentation. Gentleman said we protect surface water, that drinkable water, usable water, groundwater is usually is pretty shallow, certainly not more than 1,000 feet down. Any of the stuff that's below that is really not potable and not very usable. And the fracking wells go down about 5,000 feet or more. That the collar around these wells is heavily engineered. You all know that it was the failure of the collar that led to the Gulf Deepwater Horizon event. So the collar and the construction of these wells is extremely important and needs to be done under very tight engineering controls. And I will assert, as I've looked at this more and more, there doesn't seem to be very much governmental oversight for the people that are putting these in place. And I tell you, if I had to do a change in the wiring in my house, I'd have more governmental oversight than these plants, drilling facilities that can run millions of dollars. The casement is tested to make sure it meets drilling specifications. And once the pipe goes down, then goes off in different directions at about 5,000 to 10,000 feet, it will then, it can go out in multiple different directions in a web underground. Explosives are then put into the tip of the pipe, and the fracturing of the stone and the shale occurs. The cracks themselves can be in micron range to about 1/2 inch and can go out a half mile or so. And what begins to seep out of these cracks is the methane, and for that matter, the distillates that people want to identify, and the cracks can go up and down as much as 400 yards from these sites. I won't get into, and I have not researched the issue of earthquakes related to this, and I just don't know enough about it. But here was a presentation that Tim Kelsey did from Penn State, and I just was impressed by this picture. Here's a small, pretty Pennsylvania town, a rural road through the center of town, and you can see truck after truck after truck hauling in water, and there are other trucks hauling in sand and other trucks hauling in the drilling equipment under these small towns. It brings people, oftentimes young men, and large work crews that will be on site for the months that it takes to build it. The crews then reduce in numbers once it's put in place. The quantities of sand are just staggering. And so in Wisconsin and Minnesota, the amount of sand that's mined to be, by the way, after the cracks occur, under pressure, under huge pressure of water, the sand is put in place, and it's called a proppant. It keeps the cracks open so the methane can then seep past. But look at this, 12 million tons of sand being put on trains, put on trucks, and hauled into these rural areas where it goes. Once the drill pad is put in place, I think that's the picture that wouldn't show, the gas is then put in, actually it's dewatered, odorized, and put in pipes to then go to the sites. The opportunities for failure in this kind of thing are dramatic, but the potential for revenue for these communities, jobs, and the rest are genuine as well. Here's a USGS before and after photo of drilling pads and the pipelines being put in place to then carry it to a central compression or other kind of site where they would use it for transport. USGS map showing where these permits have been put in place. And one of the things that struck me during the Academy of Sciences meeting was this is more energy production than anything else in the United States, and the U.S. government's really not been on top of this. And the state governments very much want the revenue and are a bit overwhelmed by it, and the localities have really no capacity, most of them, to provide regulatory or health oversight for what's going on. I've certainly heard horror stories about water contamination. You've seen movies and the rest on both surface water contamination, groundwater contamination from this. I've heard industry folks say, well, those are badly done wells, or this is stuff that was from an old oil well from 50 years ago that's causing this. I'm not in a position to debate whether that's true or not, but I've certainly heard stories of the drilling waters being put into local rivers and creeks. That doesn't go on any longer, I'm told. Then putting it into municipal treatment plants, and these plants are really not equipped for handling the extraction fluids that are coming out of these wells. The fluids that are put in have to have 1 to 2% chemicals mixed in that are bactericides that prevent scaling and do other effects. But every time these have gone in, the community becomes more and more concerned and is less aware of what is going in. That slide gave credit to Mr. Eric Essien, who was the fellow from NIOSH that did these slides. It was a terrific presentation on what are the chemicals that are being put in these wells. Here's an industrial biocide. And I'm just going to say, from a policy standpoint, I don't think that anyone should be using chemicals near where people live without full disclosure to the community, to the doctors that might end up treating the workers or even treating affected or nearby community members. There's no business trade secret when we're talking about human well-being in this situation. These are some of the chemical exposures that he looked at. And there's not been a whole lot of occupational health and industrial hygiene looks by at least governmental agencies. Perhaps the industry's done a lot of the worksite exposures. Silica, all that sand is crushed up and put under pressure and becomes rustful. Diesel generators. If the well, if gas is evanescent or escaping from the wellhead or other organic compounds, people are exposed to that. Hydrogen sulfide has been an ongoing problem at other drilling sites, for example, the geysers in Northern California, metals, etc. These are big industrial operations, and it doesn't look to me like those workers are being exposed, are being protected from diesel particulates. Perhaps they are, I can't tell in the picture, but you can see with the early morning Tyndall effect just how much diesel particulates are in the air around the sites where this work is going on. This is an amazing number. Up to 4 million pounds of sand are pounded down these wells to prop open the cracks and keep them open. It's virtually 100% silica, and when it's put under pressure, it's coming out of these trucks, being put into a blender hopper, and then being forced down the well under substantial pressure. And silica gets into the atmosphere around where, in the air where the workers are, where this procedure is going. We've known for a long time that breathing, especially fine silica, is a health threat. It is regulated by OSHA. It puts you at a risk of a lung disease called silicosis and of lung cancer. And we have several hundred deaths a year from silicosis in the United States. It is a disease, besides its carcinogenic effects, it's an occupational carcinogen. It's not reversible. It's progressive. It's a difficult and horrible way to die. Here's the hot loading, because it's heated up, it's under pressure. And look at the size of these trucks that are pushing this sand into the wells. And the workers, and you can see it coming out of the pipes at the side of the truck, but I don't know if in fact that's silica itself. I was said it was silica that was coming out of the truck. But the workers describe being in this work setting as working on the beach. There's that much sand around them and silica around them in these exposures. So I would assert that worker exposures are substantial, nearby exposures. And there are some of these well pads that have been put in place in between a private home and the barn, or near a school. At least I'm told this has gone on in Texas and other parts of Pennsylvania where these operations put in place. The federal government and President put forward his blueprint for a secure energy future back in 2011. And he says, you know, the administration's calling on industry to be more transparent about the use of fracking chemicals. Seems pretty permissive to me. And said we're going to do more research, that's good. And we're going to set the bar for safety and responsibility. And he appointed a subcommittee to the Secretary of Energy to report back on steps to improve the safety and environmental performance of fracking and to develop within 6 months recommended advice to agencies on practice for shale to protect public health and environment. It's the same line. At the first public meeting, people were given 2 minutes apiece to address each of these issues. And if you go down the list, yes, it's environmental concerns. And I'm not focused on environmental concerns right now. I'm really talking about human health. People were worried about how the industry was being regulated. They were very much worried about their water, their general health concerns, their air. They were worried about bias and conflict of interest. There was a professor who was giving a lot of information on this recently. It turned out he was an executive and an appointed person in one of the major companies that had a vested interest in the drilling. In fact, I've heard the term fracademics being used. The governor of Pennsylvania, newly elected at the time, said Marcellus Shale is very important, and he appointed a 31-member committee to an advisory committee divided up into work groups and said, please report on public health, safety, and environmental protection. The governor of Maryland did the same thing and said, we want to make sure there are no unacceptable risks or adverse effects on public health, safety, and the environment. So Bernie Goldstein, former dean at Pittsburgh, did this paper in Environmental Health Perspectives, which I want to thank Bernie for, and he's been such an important leader on all these issues. And they looked at what kind of public health oversight had been provided on hydraulic fracturing. Quote unquote, our review of the background of the 51 members of the federal, Pennsylvania, and Maryland advisory committees provided no evidence that any member had expertise in the human health aspects of environmental health or experience in health or health care. Not dentists, not nurses, no one with a health background. And I'm going to blame both the agencies that have pulled these advisory committees together, and in a way I'm going to blame the public health community, because this is not easy stuff, and we need to step up and be much more visible and present, and we need to assure that there is a health impact assessment on any proposed hydraulic fracturing or drilling processes, just as there would be an environmental impact assessment. So I'm going to wrap up in a minute, but I'm going to come to solutions. But truly, an economic structure that doesn't tell the truth about the ecologic, and not just the ecologic harms, but the human health harms. And how do we assure that as we put a process in place, that every kind of energy source has human health impacts, that we want to maximize the benefits and minimize the negatives, and the people that are bearing the risks are reaping benefits, not someone at a distance in Houston or New York or somewhere else is reaping the benefits. So one is, I feel very strongly that right to know is very important. People need to have data on what's coming out of that site, what's getting into the air, what's getting into the water, what are the chemicals that are being used. There needs to be a central clearinghouse in each of the states, in my opinion, as well as that would provide real-time data. I remember reading one environmental impact statement that said, well, we'll provide the information to the public. Basically it would take months and months for that information to be provided, whether it was a spill, a chemical, or a health impact or a release. And in this era of computers, why isn't it being provided in real time? We've learned from Richmond, California, that when the public demanded to know what was being released in real time, it had benefits to the oversight of that site. We need to have good disease surveillance, especially of the workers, because these exposures are very substantial, and I don't think it's been adequate to this time, and of community exposures at the same time. It sounds like I'm endorsing hydraulic fracturing. I'm not necessarily endorsing it. I'm just saying if it's going to be done, it has to be done in ways that maximize benefits. This looks like a pretty boring slide, but everyone's heard of environmental impact assessments or environmental impact statements. These are mandated under the National Environmental Policy Act. It was put in place in 1970. And if you go through the typical environmental impact assessment and statement, and they can go on for thousands of pages, and it deals with many regulatory, engineering, and legal issues, the coverage of human health issues is notoriously inadequate. And so suddenly in a small town, if you have 1,000 young men looking for housing, looking for meals, looking for entertainment. It has a social impact. And this boomtown mentality that occurs in many of these communities, clearly the localities want to have the revenue. People want to have jobs. They're often depressed communities. People want to have a financial source in these communities, but we've got to make sure that there are long-term benefits, and it's not the typical boom-bust cycle that we see with every other gold rush. And in fact, that's exactly what's going on with hydraulic fracturing. It's a gold rush. It's a poor slide, I'm sorry, but this is the Health Impact Assessment Report, came out in 2011 from the National Academy of Sciences. It says improving health in the United States. Jonathan Fielding, the health officer of Los Angeles, was on that committee. I had the opportunity to chair the committee. Rajiv Bhatia from San Francisco was on it, and Aaron Wernham from the Pew Trusts. And one of the findings was we need to incorporate robust and rigorous health impact assessment into the assessment process. And one of the people on the committee was Dinah Baer. And Dinah was on the Council Environmental Quality in the White House for over 25 years. She's actually staffer to it. Very seasoned lawyer who said there was never any intention that health impact would be excluded, human health impact would be excluded from the environmental impact assessment. It's partly because it's not necessarily easy and it requires a lot of community input that in many ways the responsible parties avoided doing it, and the health community wasn't stepping up and really addressing it. When you do oversight and you do apply pressure on a process, you can see big changes. And this is a graph of per capita electricity sales after 1974, when we had the gas shocks in the United States, and California put in place energy efficiency requirements for refrigerators, industrial processes, eventually for cars, for other domestic and industrial sources. And at this point, California is at about half the per capita energy use as the rest of the United States. And so even-handed regulation across the board has been effective. And in many ways, if we want to reduce the health impacts of energy production, one of the best ways we can do it is with efficiency. Remember that loss. I talked a little bit about solar earlier, where I was speaking about wind. I would argue that our current photovoltaic panels are ugly. They're too costly. They're not robust enough. They contain rare earths. And if we had really developed the technology adequately through the 1980s and 1990s, I would argue that virtually every home in the United States very quickly would have shingles that were photovoltaic and generating energy anytime the sun shone. And in fact, oftentimes when we need the most amount of electrical energy is when the sun is brightest and it's hot. It would require less demand on the grid, less wear and tear and commit. And we're going to need much more than just solar, but the combination of much more efficiency and local generation of energy makes sense. So big takeaway, I do think that research into safer and healthier energy sources and research into the health impacts of these sources and doing all cost accounting and full health impact assessment of our energy sources is what we need in the United States. And in that portfolio, perhaps fracking or hydraulic fracturing is in there. I'm not arguing for or against it, but I am saying it certainly up until now has been, in my opinion, under-regulated. And with that, I will stop and thank you all for attention. I'm sorry I was silent there for the first few minutes.
Thank you, Dr. Jackson. If anyone has a question, please type it in the field at the bottom of the chat window in the bottom left-hand corner of your screen. We have a question from Brenna. She says, hi, Dr. Jackson. From your comments on the needed public health impact studies and following the precautionary principle, it seems you would support a moratorium in California until such studies and public health impacts were provided and recommendation to minimize such impacts. Do you have she also goes on to say, following your theme of the precautionary principle, you also did not mention what we do know about fracking and health. The University of Colorado peer-reviewed study showing severe showing severe air quality problems near fracking cities, and that those living near cities were at a much greater risk of acute and chronic health conditions. Dr. Jackson, would you like to answer that?
No, I'm not going to comment on the Colorado work, and in fact, the committee or the group I work with, John Adgate. And by the way, what I've told you is not necessarily incorporated into the comments I provided to New York State. These are my opinions offered in the noon seminar. Dr. Adgate's the expert on this, and I've decided not to dive into local air quality issues, and I've been focused on the Marcellus Shale in particular with the report. The precautionary principle sounds great. Most Americans argue for it. It is not the law of the land in the United States. The National Environmental Policy Act is right now the law of the land, and we need to require adequate looking at the health impact in that process. You can do health impact assessments briefly, or you can do them in great depth. I think we need a national one in great depth, and it's just absurd that we're 5-7 years into this vast enterprise of doing hydraulic fracturing, and there's not been a full-blown national health impact assessment, number one. I won't argue on whether, fracturing has been going on. It's often in old oil wells that are being reopened to extract both natural gas and distillate at the same time. I think scrutiny for that needs to go on, but I'm reluctant to dive into the air quality issues because it's not something I'm conversant in.
Okay, thank you, Dr. Jackson. I have a quick question, or actually, the LA County Public Health Water has a question for you. They say, what issues would we need to know as far as dealing with wastes, i.e. chemicals, wastewater, drilling solids produced by the fracturing process?
You do this for a living, so you probably know it. By you, I mean the water district know it better than I. One, you need to know what are the chemicals that are being added to the water being pushed down these wells. And as I said, they're bactericides, etc. Two, when these things are then returned to the surface, the fluid and the tailings return to the surface, they can contain certain amounts of naturally occurring radioactive materials. That needs to be scrutinized. There has been discussion about storage in sealed and lined facilities. There are concerns about that since they fail over time. I have heard concerns about radon and other chemicals being present in the gas itself once it's been pulled from the shale or below ground. The oil sources in California are actually, or the fracking sources are in California are different. It's my understanding that these are more maritime sediments, and they are different from the shale in the Marcellus area. I think probably the Water Board and the Water Resources Control Board need to set up a proper regulatory process and hearing process to decide exactly how to handle it in our state. This is what they do for a living.
Okay, thank you. We have another question from Dr. Suzanne D. Benedictus. How adequate is the WHO Health Impact Assessment?
Is the WHO? I don't understand. You mean the World Health Organization?
Yes, sorry, World Health Organization Health Impact Assessment.
And, I'm guilty. I'm not aware that the World Health Organization had done a in-depth health impact assessment of hydraulic fracturing. So I claim ignorance on that.
Gina Natoli asks, can local jurisdictions regulate the use of these chemicals at the well site, or does the state or federal government have supremacy?
It varies by locality. My understanding when I was in Pennsylvania recently is the state has preempted, and folks from Pennsylvania may want to correct me on this, has preempted local jurisdiction and control. It does appear that the depending on who's doing it, they want it both ways. They want the state to regulate if the locals look like they're going to do something, and then they want the locals to regulate if the state's going to do something. But it does vary from locality to locality.
During your talk, you said how high-volume hydraulic fracturing is being employed in many regions of the United States. How many health impact assessments have been completed at the national level? And do we know how many have been done at the state or regional levels?
I did not do a survey of that. I know New York State is in the process of doing quite an in-depth one. I have read that one closely. I am not aware of some of the impact assessments elsewhere. Where I do not believe there's a full-blown health impact assessment at the national level. I think we desperately need it given the breadth of this activity.
We have another question from, I'm sorry if I mispronounce your name, Seth Shonkoff. It says, Dr. Jackson, you spoke about carbon dioxide emissions from natural gas and compared them to coal, yet you failed to include emissions of methane during the production of shale gas. Most recently, NOAA asserted in the scientific journal Nature that 9% of total methane production is vented the atmosphere, putting it above coal in its climate impact. Methane is not only a strong GHG, but is also a precursor to background tropospheric ozone levels, a driver of poor respiratory health. Could you please comment on the implications of these data in terms of your comments today?
You're absolutely right, and I did not remember to include it. I actually didn't talk about extraction of methane from landfills and other sources. There are releases of methane from these sources. I watched a video of using a certain kind of isotope camera of methane being released from fracking sites in Texas. Large amounts of it were being released. It is extraordinarily important to be capturing. I mean, the reason they're doing these wells is to capture methane, but it is often being released in the atmosphere. The person that raised this issue is exactly correct. Methane is a far more effective greenhouse gas than is carbon dioxide, and it is a major contributor to local air quality problems, and it has its own set of risks as well. I really feel very strongly, and I want to come back to this, that all energy sources have health impacts, and as we pick what we're going to work on, we need to minimize the negatives on the ones that that we're using. And I do think that moving coal power plants to methane is a big improvement.
We have a follow-up question from Dr. Suzanne De Benedictis. She says, clarifying my earlier question, the World Health Organization has an assessment tool. How can we get LA County to do this for the 300,000 residents living around the Baldwin Hills Inglewood oil field? What do you recommend citizens do to get adequate health assessments as soon as possible?
I believe this is a pretty local issue. I don't want to dive into it too deeply, but there was a item on the ballot recently in Los Angeles that would surtax oil and gas production in the Los Angeles region. That lost. Clearly, if something's generating this kind of wealth, or at least this kind of revenue, that some of that money should be used for a health impact assessment. I know I have been a state health official in California. I know the pressures that they're under. It's very difficult to take on a very costly and laborious impact assessment without additional and directed appropriation. I was very concerned in other states, and I won't name the state right now, that enormous amounts of resources go into the environmental impact assessment. It's done within the environmental agency. The health questions come up and they say, here, health department, you deal with it. And the health department is inadequately staffed. It doesn't have the health physicists. It doesn't have the epidemiologists. It doesn't have the staff that can deal with these specific issues. And it needs to be part of the revenue stream that comes out of these wells is supporting the health functions as well as the environmental regulatory functions. So, you know, get a bill on the, or get something on the ballot measure and require them to do it, but make sure you're paying for it, because it's not going to happen unless there's, as we used to say at CDC, don't give me an authorization, give me an appropriation if you want me to do something.
I think we have time for one or two more questions if people want to go ahead and type a question in the bottom of the chat window in the bottom left corner of your screen. Dr. Jackson, you said that water is an integral component of the hydraulic fracturing process. Can you elaborate a little more on why high-volume hydraulic fracturing is exempt from the Clean Water Act and Safe Drinking Water Act?
Why I can't even figure out why it's called the Halliburton Exemption in the year 2005. I think it's pretty obvious why it's exempt. I don't mean to be flippant with that answer, actually. What I mean to say is clearly this is big politics, and anytime there's this much money, it's very big politics.
Okay. Well, thank you, Dr. Jackson. It looks like we will wrap up this Q&A session. You know, Dr. Jackson, thank you so much for joining us. I want to say thank you to everyone else for tuning into this webinar. Please join us next time on Wednesday, February 13th, when we continue the conversation with Dr. Marjorie Kogawa-Singer, who will talk about defining culture in research. If you missed any of our previous webinars, please go to the Fielding School of Public Health's website at ph.ucla.edu. They are all archived there, and please allow a few days for this one to post. Thank you.